Many seniors find themselves losing muscle mass as they age. This has been shown to lead to increased falls, increased joint pain, and can even be a predictor of how long you'll live. The important thing to know is that this can be reversed. By making a few simple, healthy choices, you can beat Father Time. In this video, I'll show you how to get started. Losing muscle mass is a condition known as sarcopenia. This can be caused by a variety of things such as hormone levels, chronic disease, inadequacies in diet, but most of all by decreased activity. There are a couple of factors that you may not have total control over, such as natural hormonal changes and the ways that our nervous system conducts electrical impulses to our muscles. Everybody is affected differently by these, and genetics actually play a big role. However, there are many well-documented examples of a person who can make a change to the factors we can control. By doing this, they significantly gain muscle mass and improve bone density. The first thing we can control is our diet. In our experience, most seniors do not consume nearly enough protein in their diets. Protein is essential to build muscles. And if you do a simple Google search, you may read that the average senior should get about 0.5 gram of protein per body weight or per pound of body weight. For anyone not watching in the US, that's a little over 1 gram per kilogram of body weight. However, we really don't agree with this. We have been watching the research closely, and the most recent literature suggests that seniors should get at least 0.75 grams of protein per pound, and preferably closer to a 1-to-1 ratio. This means that someone who is 165 pounds should consider consuming about 125 to 165 grams of protein each day. For reference, 1 ounce of chicken has about 8 grams of protein, and 1 egg has about 6. Be honest, are you getting enough protein daily? The next thing I want to talk to you about is creatine monohydrate. For many years, creatine was a debated topic, and some health experts were not sold on it having a meaningful effect on muscle gains. It became a widely popular supplement with bodybuilders and some fitness gurus, and the amount of research since that has been published is gigantic. Today, it is recommended that seniors take creatine at an increasing rate. Not only is it great for helping build muscle mass, but some studies suggest that it may also have a positive effect on staving off neurological disease such as Parkinson's, dementia, and MS. If you have high blood pressure, diabetes, or kidney or liver disease, then make sure you talk to your doctor before starting creatine. Okay, so we talked a bit about diet and supplements. Now for the biggest and most meaningful thing you can do. By the way, my name's Justin, Doctor of Physical Therapy. We are passionate about getting free content directly to you. In order to keep doing this, we need your support. Please like this video, leave us a comment, and subscribe to our channel. If you have a friend or family member that you think could benefit from our content, please share it with them as well. Now back to the meat and potatoes. High resistance strengthening exercises are by far the best thing you can do to help combat muscle loss with age. Bone density is also positively affected by this type of exercise, and usually muscle mass and bone density go hand in hand. But what exactly constitutes high resistance strengthening? Well, it has to be 60% or more of your 1 rep max. Since you probably won't be testing your max strength, it's a good rule of thumb to follow a rep guideline. Usually, if you can't do at least 8 reps, you're working at around 70 to 80% of your 1 rep max. If you can do 15 reps or more of whatever that exercise is, you're below 60% and need to increase the difficulty of the exercise. Another good way to tell if you're working with enough load or resistance to make a real change in your muscle is called the RPE scale, or rate of perceived exertion. You really need to be working a good chunk of your time at a 7 or higher. That means that if you can carry on a conversation while you're exercising, you are not achieving your goals. You should be able to speak a sentence or two, but you should be noticeably breathing heavy and exerting energy. We're going to throw up a RPE scale here. It's a good idea to take a good mental snapshot of that so that you can reference it while you're doing your exercises. So what types of exercises should you do? Well, anything is better than nothing, but multiple joint, complex movements that involve 2 or more of the big muscle groups are the best. Some of our favorites that we do with our patients are sit to stands, where you're getting your quads working and your glutes, rows, where you're working your biceps and your back, or lunges, where you're kind of working all of the muscles in your legs. This video is not meant to go into the detail on how to do each one of these exercises. The main point that I want to get across to you today is why you should be doing them and how intense you should be doing them. We have a lot of other great content that we've covered on the specifics of the exercises, so make sure to check them out. One point that's worth bringing back up is keeping that rate of perceived exertion, or RPE, at around a 7. Again, you should be able to get a sentence or 2 out, but you shouldn't be able to carry on a conversation with your spouse or your neighbor in the gym as you're working out. Speaking of gyms, most of them have a lot of different choices. And most of the time you can get a nice orientation where they'll give you a little tour and show you all the different machines. We're not a big fan of just doing the machines that make you do everything a certain way. We like to use a little bit more freedom, which also makes you have a little bit more control when you're doing these exercises. So keep that in mind. Lastly, I want to tell you about the trap that so many of our patients fall into in hopes that you won't make the same mistake. Most seniors have at least one source of chronic pain, whether it be a lingering back injury, a shoulder issue, or arthritis in your hips or your knees. This pain can be made worse temporarily when you increase your level of activity. However, soreness and increase in pain after doing something new or harder than you are used to is completely normal. Too many of our patients get freaked out whenever this happens, and unfortunately think that the best thing to do is take time off until it goes away. This is a trap. 9 times out of 10, doing the same routine that made you feel sore last time will feel much better the second or third go around. On the contrary, taking a week off will only lead to more inactivity and even more muscle atrophy. Even if the soreness subsides, you'll now be worse off than you were before with an even larger mountain to climb. My advice is to work your way into a challenging strengthening routine over the course of a couple of weeks, but stay consistent and make sure to do resistance training at least 3 times per week. If you do wake up sore, go for a walk, a bike ride, or a swim and get back at it. As always, leave any questions you have in the comment section below, and I'll always do my best to answer those questions. Also, check out this video that goes into a little bit more detail on strengthening for seniors. Until next time.